What are stroke mimics, and can they look like a mini-stroke? Imagine feeling sudden weakness or numbness and wondering if it's a mini-stroke or something else entirely. That's where stroke mimics come into play. Stroke mimics are conditions that cause symptoms similar to those of a stroke but are caused by other health issues not related to blood flow problems in the brain. They can look just like a mini-stroke, which is also called a transient ischemic attack, making it tricky to tell them apart at first glance. Symptoms of stroke mimics often include sudden weakness, speech difficulties, numbness, or visual changes, symptoms that are typical of a stroke. But these symptoms can also come from other causes like seizures, migraines, infections, or metabolic issues. For example, a seizure might cause temporary weakness or speech problems afterward. Migraines with aura can produce visual disturbances or numbness that seem like a stroke. Low blood sugar, or hypoglycemia, can lead to confusion, weakness, and speech changes. Infections like meningitis or encephalopathy can cause neurological deficits that mimic stroke symptoms. Sometimes, functional neurological disorders, where symptoms are due to nervous system dysfunction without structural damage, can look like a stroke too. Other neurological conditions like multiple sclerosis may cause episodic symptoms that resemble a mini-stroke. Because these mimics can develop symptoms suddenly and sometimes resolve quickly, they often look just like a mini-stroke. However, there are differences. Stroke symptoms usually involve a sudden loss of function, like weakness or speech trouble, without additional signs. Mimics might also include positive symptoms such as abnormal movements, hallucinations, or spreading pain, which are less common in true strokes. Distinguishing between a real stroke and a mimic is very important because treatment depends on the cause. Doctors relying heavily on brain imaging, especially magnetic resonance imaging scans, to tell the difference. They also look at clinical features like age, risk factors for vascular disease, eye movements, and cognitive status. For example, a younger person with no risk factors is more likely to have a mimic. Despite careful evaluation, misdiagnosis can happen in about 15% of cases, so thorough assessment is essential. Understanding stroke mimics is especially important when recognizing mini-stroke symptoms. Both conditions can present suddenly and look alike, but their management is different. If you or someone else experiences sudden neurological symptoms, seeking immediate medical attention is crucial. Proper diagnosis ensures the right treatment, helps prevent future strokes, and avoids unnecessary interventions. Remember, always consult healthcare professionals for personalized advice and diagnosis, as individual cases can vary widely.